The components of yoga go way beyond what we define in the West as a physical practice. It is actually a practice, a science of health and well-being. Then this construct that I'll be going over about the way I consider putting together a therapeutic class for cancer patients. Any cancer patients. Of course, the research has mostly been done in breast cancer survivorship. So what happens when we consider a diagnosis? Most of us start taking shallow breaths. We're filled, or maybe holding the breath and breathing, inefficiently because we're maybe panting. But if you just look at the research on breathing and the amount of time in yoga that is spent on breathing and breathing practices, we know that this is greatly impacting health. Let's just start there and we'll come back to what goes on in our mind when there's a crisis. A diagnosis of cancer is a major crisis. So we start thinking rapidly, maybe negative thoughts. The nature of our mind is basically to keep us safe. And when we perceive any kind of threat, we're going to go into that mode of fight, flight, or freeze. I'm hoping that you're writing, calling out, and thinking with me. So for our emotions, I will say that I had a lot of anxiety about the future. I was scared. I felt overwhelmed. So this is a person that has a lot going on. So this construct for teaching yoga for cancer survivors therapeutic class, I'm calling this pillars, the things that sustain us in life, the things that we're involved in that are at risk during a diagnosis. So it could be our work and our friendships, and some of us use nature, some of us have other ways of thinking about the world, but in yoga we have the yamas and the niyamas, and here again I will be putting references to talk more about that. But in order for us to be holding up someone experienced this kind of trauma, we really need to know at a very deep level who we are and what we believe.